Hiya. Hello, sorry I was a bit late, Destiny. How are you?
You are fine. I'm good. I'm good, thank you.
Don't know what's going. Honestly, I feel like I'm jinxed in life at the moment. Everything I tried to go to do today just hasn't worked out for me. And I was trying to desperately hit to get onto live, and it was just like, no, not happening, not happening. Anyway,
Sometimes Instagram just doesn't want to play ball.
it just does not want to play ball at all. I am so pleased to see you. I know we've sort of had this in the diary for a few weeks now. So
Yes.
I'm so excited.
I know. Thank you so much for having me on. I'm so excited. I've had so many of my followers be like, oh my God, I can't believe you're going on the C list. And I was like, I'm
brilliant.
so excited.
Oh, honestly, it just means the world. And I know that, so January, randomly, is Cervical Cancer Awareness Month. Now, some people say cervical, some people say cervical. I don't know which one it is.
So,
do you?
I think it's cervical. I think the other one might be slightly American.
I think it's
However,
American.
it is actually, the awareness month is American. Over in the UK, we only have a prevention week, which is from the 17th to the 23rd. However, because of how Instagram is or social media, we kind of jump on the bandwagon and say it's the whole month. I don't know why we don't have a whole month when all the other cancers do. But it is actually just over in America that they have the whole awareness month, whereas we actually have a prevention week, which is obviously pretty much the same, prevention and awareness.
Of course it is. Of course it is. Now, your story, oh my God, it's like, I feel like it should be turned into like a Netflix series or something.
Oh God.
You literally couldn't make it up, could you?
No.
So should we start from the beginning? Just tell us your story and how did it come about? Like, what was the first sort of warning sign for you?
Yeah, absolutely. So I'm now 29, but when I was first started having symptoms, I was only 27. So this all started like January 2 years ago now. I started having some abnormal bleeding in between my periods. I'd been on the same contraception for 15 years or so, you know.
What, like a pill, was it?
Yes, yeah. I went on a pill at a very young age to control my periods and stuff. So I've been on that pill for a long time and had no issues with it. So the abnormal bleeding in between periods was a little bit concerning, but at the same time, us females always get fobbed off, you know, hormones, stress, diet, everything like that. I actually had my letter come through for my reminder to book in for my smear test. And I thought, I can book it a couple of months early, you know, just to put that at the back of my mind. So I actually booked it for March. It was due in the May, but I booked it a couple of months early. Unfortunately for me, because that's pretty much exactly the same time that COVID all started kicking off.
Oh God, yeah.
They cancelled my smear. With the famous last words when they rung me and said, because of your age, you are considerably low risk for cervical cancer. So we want to put you off. And they said, it'll probably only be sort of 6 months until this whole COVID thing blows over.
Yeah.
And then we'll get everyone back in. At that point, I was only talking to a receptionist and I sort of said, I have had some abnormal bleeding. I'd really like to still be seen. And she said, I'll get a doctor to ring you back. Doctor rang me back, yet again, reassured me, you're extremely low risk. Your last smear was completely normal, no abnormal cells and no HPV detected. So they reassured me again. And he just said, you know, if these symptoms continue, then definitely, you know, give us a call back. By this point, I'd started having some abnormal bleeding after sex as well, which yet again was unusual, been with the same partner. So all these things started adding up. But at this stage, I didn't think cancer. I just thought maybe something else, but I didn't think cancer.
So this was 2020 and you were 27 at the time?
Yes. By the time my 28th birthday came around, and which was the May, and that's when obviously my second smear would have been due, but I tried to book it earlier. I had been in contact with my GP 5 times over these symptoms that were worsening. But throughout all of this, it was because of the pandemic. They just refused to see me face to face. They tried to, I also had COVID right at the start. And yet again, it sounds really silly now, but at the time, you know, my GP was like, you've had COVID, you've been really unwell. Maybe it's your body just reacting to it. We don't know a lot about this COVID stuff. So let's just wait. And yet again, even though I'm a nurse myself, if I've got a GP telling me I'm not concerned about your symptoms, just wait another couple of weeks. If they don't get better, we'll try you on this, we'll try you on that. I was put on 3 different courses of antibiotics for infections that I didn't have. I was asked to take 3 swabs for STDs and stuff like that at home and bring them into surgery because of my age. Yet again, they instantly think it's something to do with an STI rather than anything else. And I just had a losing battle with them, unfortunately. And it was around May that by this point, the bleeding had become very regular. And also I was getting some really watery discharge.
Right.
And
so this is a year, this is like a whole year and a bit of symptoms.
No, sorry. No.
Oh,
so
okay.
The symptoms started in about the January.
Right.
I got my first diagnosis in the June. So I had symptoms for about 5 months. But I was fighting to see somebody. But so
you're a nurse as well. Like,
so I just couldn't physically get in to see a GP. So eventually the final straw, I went to A&E. And yet again, in the middle of a pandemic, feeling like an absolute idiot walking into A&E saying, I've got some unusual bleeding and discharge. I'm sure it's nothing serious, but could someone just check me out? Because I've been battling for 4 months for someone to examine me. And they were great. Don't get me wrong, it was very quiet in there because that was, yet again, right at the start of the pandemic, no one wanted to go near a hospital. And I'd worked throughout the pandemic anyway, at the start anyway. So I went into A&E and they examined me, and the on-call doctor that night, it was around about 10 o'clock I went to A&E because I just couldn't sleep because I just kept worrying that it was something really serious by this point. And I went to A&E and they examined me, and she literally, her face dropped and she was like, are you sure you haven't left a tampon up there? That was the first thing she said to me. And I was like, I'm pretty sure. Why? And she was just like, have you ever had a miscarriage? And I was like, well, not that I'm aware of. Literally, she just kept saying all these really random things. And I was literally like, tell me what you can see. And she was like, well, I can just see a tennis ball size mass coming out of your cervix.
A tennis ball size?
Yeah.
And was this on an ultrasound, or was this like a internal?
No, she just did an internal examination. And I mean, she's not a gynecologist, so that's how obvious it was of how big it was that she could see it like that. Straight away, she rang for her more senior doctor, who said, don't touch it. If it ruptures and it bleeds, this woman's going to bleed out here. And obviously I'm sat there at the time thinking, oh, and you know what that means. Yeah. So they made an urgent referral. So this was 3rd of June, made an urgent referral for me to be seen by the gynecologist team. But obviously on the cancer pathway, you have to be seen within a couple of weeks. And actually from the day I went into A&E that night, it was exactly 3 weeks later, I got my official diagnosis and my staging and my treatment plan. So actually, the delay of me getting in to see somebody was the hardest part. Once I'd actually been seen by someone who took me seriously, it went like that. I was in for scans, bloods. I had an ultrasound. I had an internal ultrasound. I had a biopsy. I had a PET scan, an MRI scan, a CT scan.
Oh my God.
And I got all the results back within 3 weeks and was sat down in that room. And I knew by that point,
you knew what it was
and stuff. I knew what it was. It was just a matter of what my options were. I went into that first meeting, and yet again, middle of the pandemic, if they say to you, you're allowed to bring someone in with you, it's probably not going to be great news because yet again, they wouldn't let anyone go in with you or anything really. So we kind of knew what we were dealing with, went in. So this was
who did you go in with? Did you go in with your boyfriend?
No. So, no, we had broke up by that point. I went in with my best friend, who is also a nurse. So she was a great person to go with me because I needed them to, like, 2 sets of ears, someone to really understand. And to be honest, went in, they told me that I was stage 2B cervical cancer, which means that it was contained, the tumor was contained within the cervix, but it was bigger than what they would usually recommend for surgery, i.e. a hysterectomy.
Right.
So that's usually if you're a stage 1, you can have a hysterectomy.
Right.
I say have a just have a hysterectomy, like it's easy.
Yeah.
Surgery is the option if you're stage 1. Stage 2 or 2B, mine was where mine had grown down into the vagina. They class that as a 2B because it's gone into the next layer, if that makes sense, rather than just in the cervix. And then obviously 3 is if it goes into lymph nodes. Thank God mine hadn't gone into lymph nodes.
Yeah.
But at that point, they said to me, you need to have chemo and radiotherapy. And the first thing that came out of my mouth was, am I going to lose my hair?
Yeah, it's so interesting. That's what so many oncologists say. It's like it's am I going to die? Am I going to lose my hair?
No, I didn't ask about the dying. I just said straight away, am I going to lose my hair? And they said, well, no, you shouldn't, because the chemo we're going to give you doesn't make you lose your hair unless you want to opt in to take this trial. So that's a whole nother bag. But basically, there was a trial that I took part in, and it gave me an extra 6 doses of a different type of chemotherapy to try and see whether that would prolong my time in remission. And it was a worldwide study, so it wasn't just in the UK that they were doing it. And that particular chemo would mean that you would lose your hair. So straight away I said, no, not even an option. Don't want to take part. I'm good. Thank you. Bye. 5 weeks chemotherapy and radiation would be sufficient to, cure me of the cancer. I'll take that. It wasn't until I went away and did some more research into the trial. Being an oncology nurse myself, I know how important it is of these trials.
How is that? You're an oncology nurse?
Yeah. In my defense, I do only look after children. So cervical cancer is not one that I've ever come across, ever.
Yeah.
It's not something that we have in children. So, but yeah, I only work down the road from my hospital that I'm treated at. So it's very close to home. I work on a chemotherapy day unit. So I give chemotherapy day in, day out, back to back. So I'm very familiar with, all of this. So with that being said, I went away and thought, am I being selfish by not taking part in this trial? Because this could potentially help people in the future.
Right.
And with that, I did some research and I found it was possible to have something called the cold cap, or the scalp cooling. Yeah. So I asked my oncologist. She said, yeah, we can give you that. It doesn't work for everyone, but if you're willing to try it, I would love, I really want you to do the trial. So I agreed eventually. So I had 6 weeks of just chemo. So once a week I would go in, I would have the cold cap, absolutely froze your head, as you can imagine. It was literally like having an ice bucket chucked over your head continuously for 6 hours of the day.
Yeah, I had I used the cold cap, and it's a long period of time to have that on your head. It worked for you.
It worked amazingly. I must admit, everyone that I come in contact with says to me, I've never seen it work so well for anyone before. But I Googled this like anything. I found any bit of advice that I could find, even down to a silk pillowcase. So you didn't.
Oh my God, I did that.
Yeah, I literally did. I followed the rules to the T. Yeah. And for me, I lost eyebrows, I lost eyelashes, I lost body hair, but the hair, never. It thinned a little bit, but nothing. So
that's amazing. Was it a Paxman machine?
Yes.
Yeah. So I'm
the
friends
cooling
with Claire Paxman, from the Paxman, and I've done a few talks with her before.
Yeah.
And that, I don't know if anybody knows this, but that scalp cooling system was designed by a family, basically, well, by a guy who had a job in refrigeration or something, and his wife had breast cancer and she lost her hair and she passed away, but the biggest thing for her was losing her hair. So this family the Paxman family made it their lifelong ambition to create this machine, and that's just brilliant that it's worked so well for you.
I used their shampoo and conditioner as well. They have their own brand of shampoo and conditioner, which I went out of my way to go out and buy. And that's why I follow. It's incredible. And yet again, I work with children. It's not something we offer with children. So it wasn't something I even really knew existed, even though that's my job, because I specialize with children. I didn't even know. So for me, it worked amazingly. And I do always say to people, you know, you really need to weigh it up. It's a long time to have it on. Some people get awful headaches. Mine was more, it's not the right word burn, but it's like a cold burn. Mine across the front would be like, my head would be red, raw afterwards for days. It was really sore. But for me, that was the first thing that was my deciding factor of whether I took part in this trial or not, because I just couldn't stand the thought of losing my hair. And I know to some people it seems very trivial, but to me, it's so much of my identity. So
it absolutely is. Because actually, to that point, you do a lot of working out, and is that like it's quite a serious hobby that you've got?
Absolutely. So I do bodybuilding.
Bodybuilding,
and I compete. So but yet again, that's, you know, there's a lot of people out there that say you can still do that now, and absolutely, I'm very passionate about it. But you know, it's a lot of your identity, what you are as a person. And to me, you know, everyone sort of knew me as the girl with the really long blonde hair, or, you know, so for me to then lose my hair would have been massively like impacted on my mental health as well. So I'm amazed that it worked as well as it did. I know lots of other women that have either given up or tried it once and it was too painful, or it didn't work for them. So, you know, I'm always trying to advocate it. However, I do try and say to people, it's not for everyone, and unfortunately it doesn't work. I mean, luckily for me, my eyelashes grew back amazingly, my eyebrows, you know, but yet again, I know lots of other people that even though they kept their hair, they lost their other hair, and that was still really, because I can see someone put losing eyebrows was the worst thing, and it is. However, I will say, which is going to sound absolutely crazy, on the reverse side of things, because I didn't lose my hair, I didn't look like a cancer patient. And every time I walked into that cancer unit, I would always get mistaken for a member of staff. Or or even when, or people would think that I was visiting, or I was like looking after my mum who was coming to look after me. And also I would get people say to me all the time, "Oh, you look so well." And I'm thinking, I'm not. I'm literally dying inside from this chemo. But because I didn't lose my hair, from the outside point of view, I didn't look sick, and I didn't look like I had cancer. So
was that ever an issue for you? Because I've had women say to me in the past that they felt like they weren't sort of taken seriously enough because they hadn't lost their hair. And I feel like it's almost like are we supposed to go bald, so it's like a badge of honor or something? I don't know. It's an interesting, I think, way to look at it.
By the end of my 12 weeks of treatment, I'd heard it so much that I kind of did feel like, oh, maybe I should have lost my hair, because I felt like I wasn't I wasn't like an established, you know, cancer patient, because I didn't. And even down to a couple of the doctors had looked at my notes and said, "Oh, there's no way that you had that chemo because you've still got your hair. That must be an error." And I was like, "Oh God, no, I did have that chemo." Or, you know, they would say like, "Oh, you weren't on the trial because you've still got your hair." And I'd say, "Well, I was, but I asked for the cold cap." And they were like, oh. So it's kind of almost a bit like a reverse thing, that because I looked fairly normal on the outside, no one really knew what was going on the inside. So it was kind of,
I just noticed a second ago, somebody just asked a second ago, do you always
I can't hear
lose your hair? Oh, can you hear me now? Can you hear me now? Yes. A second ago, somebody asked whether you always lose your hair when you have chemo, but it really depends on the type of chemo that you have. There are certain chemos that do mean that you'll lose your hair if you wear the cold cap, and others don't actually touch your hair, do they?
So the actual standard 5-week chemotherapy that you get for cervical cancer is cisplatin, and you do not lose your hair. But because I opted to take part in this trial to see whether an extra 6 doses of chemo would prolong my time in remission, then that particular, there were actually 2 chemotherapies that I had together. Them two caused hair loss. So yet again, for me, it was a case of, if I do the trial, I could potentially lose my hair, and if I don't, the side effects of cisplatin on hair is very, very low. So it's not something. And there's lots of chemos out there that don't cause hair loss, but there's unfortunately a lot that do. So it's usually the first sort of thing that you associate, isn't it, really? So
and you don't get to pick which chemo you have. It all depends on what your diagnosis is.
And it's all depends. Exactly the same with as much as they've designed the cold cap and it's amazing, but actually, yet again, there's a lot of cancers that you're not eligible to have it if you have that particular type of cancer.
Oh, right. Okay.
So it tends to be the cervicals and the breast cancers that can have it. But yeah, so there's always lots of sort of like rules to the exception and stuff like that, isn't there?
Yeah.
But I had my chemotherapy the 6 weeks, and then I started on what was the standard treatment. So I had the second type of chemotherapy plus 5 days a week radiotherapy, which yet again is going to sound absolutely crazy, because yes, I am an oncology nurse myself, but I had no idea what radiotherapy actually involved. I laid in that machine the first day thinking I was going to get zapped. There was going to be some lasers coming at me, because I'd never actually been in the machine.
Wow.
Obviously, I've nursed patients, but I've never been in the machine myself. So that experience within itself was crazy, because I was like, you don't feel anything? How's this doing anything? It's almost like a surreal feeling of like, I don't think it's working, and I'm not convinced this is going to do anything. But actually, it's the radiotherapy that probably does more harm than sometimes the chemo does to the actual tumor itself. And that's true. The key part.
So can I ask so is this a stupid question, but when I was in the radiotherapy thing, I was sort of strapped in, and I was all obviously zapped, around my chest area. So were your bits getting zapped, or was it your tummy, or was it?
It was from the pelvis, so kind of from the belly button downwards to. So one of the biggest side effects that women will get from having pelvic radiation is that our ovaries and our uterus get zapped. So then that puts us into the early menopause. So most of us ladies were sort of told that that's what would happen. Also, if you think about that field, so probably like with you where you had it up here, they gave you the whole talk about, did you have to do the breathing, holding with your heart and stuff? We can't do that with our bladder and our bowels, but we have to go through certain protocols, emptying our bladders, emptying our bowels and everything like that to try and protect them as much as possible.
Oh, okay.
Most women, it's kind of a 50-50 chance, I think. You're either going to come out with a weak bladder from the radiation, or you're going to come out with a weak bowel from the radiation.
Okay.
Yeah, most people I speak to have one or the other. You're extremely unlucky if you have both, and you're amazingly lucky if you have neither. I came out with horrendous bowel damage to my bowels, and that's still ongoing. But other ladies I know come out with, can be as bad as being incontinent, really. So yet again, all the side effects that people don't really tell you about, or don't explain to you or prepare you for. And then you go into here, and the same with you, you go in there thinking, oh, this can't really be doing much. But actually, when it actually all starts and it starts giving you all the side effects, and you think, oh God, so, and yet again, you would probably be able to relate to this. I didn't expect that level of fatigue from radiotherapy at all. I've never experienced anything like it.
It's through the roof, isn't it?
Yeah.
Unbelievable. So you had that for 5 days?
5 days a week. So Monday to Friday for 5 weeks.
Oh, for 5 weeks. Okay. Yes. So mine was 3 weeks. That's really intensive.
It's very intensive. And then to top it off, at the end of that, you get something called brachytherapy, which is just the most torturous thing I've ever been through. And I'm sorry if anyone watches this, and I don't talk about it often, because at the end of the day, I like to be honest, but I don't like to put people off. But it was the most torturous thing I've ever gone through.
What is it?
It's internal radiation. So what they do, and you can imagine they only do this to cervical cancer patients or prostate cancer patients, because there's a way in.
Yeah.
And you can imagine which way that is in.
Yeah.
So they basically put some rods inside you up into the tumor, and they directly blast the last of the tumor cells directly with the radiation. But that means that their metal rods have to go inside you, and it's extremely painful. And at some stage, then metal rods have to come out again. Let's just say it's not a pleasant experience.
And is that at the end of the 5 weeks that you do that, or after the end of each session?
No. Well, most people have between 2 and 5 sessions of the internal, but it's always at the end of the block. Some people would have maybe have it at 4 weeks and 5 weeks, but they don't tend to do it any earlier than 4 weeks, and then right at the end. It tends to be what they kind of class as the last punch to get rid of that tumor. And that's what they kind of say, because it's directly going in. It doesn't cause too much damage to the surrounding tissues, but it does the most damage to that particular area. And I think moving forward, that is something that they're going to maybe look at. But as in, do that treatment more, because obviously it protects the other organs and, stuff around it, but it's not a pleasant experience. And yet again, it depends where you're treated. So my treating hospital, they get you in for a 2-night stay, and they do, whether you need 3 to 5 or whatever, they do it 6 hours apart. So you're literally in, have the first one, you then lay in a bed with an epidural with these metal rods hanging out of you for another 6 hours. Then they give you the next one. Then they wait another 6 hours. Then they give you the next one to do it all in one go. Whereas I do know other hospitals get the ladies come in, they do 2, and then the following week they do another 2 or something like that. But
and am I right in thinking you've been doing all this by yourself? All your chemo, all these radio sessions?
Yes.
Because this is all through COVID, isn't it?
Yeah.
You've been doing
this. I was never, my mum never came into the hospital with me. She was never allowed to come in, no matter how sick I was. Even before I started all my treatment, I had an ovarian transposition to move my ovaries, so I had to have surgery. And even then, my mum wasn't allowed to come into the hospital to pick me up. I had to walk down to the desk, like the front desk, and a nurse brought down my suitcase, and then literally my mum had to wait at the front door for me. So even throughout all of this, even when I was I had to be an inpatient for a week because I was septic and neutropenic, so never was allowed anyone in with me. So this whole journey was so hard. I mean, for me, like I said, I could walk into the chemo suite and feel fairly confident I knew what to expect. But walking into radiotherapy, I was literally like, oh my God, what the hell? Like I said, I didn't have a clue what to expect. So I can only imagine what it's like for somebody that has never even been into a hospital, which is the crazy thing. Thankfully, my mum was able to come in with me for the results, sort of, chat and stuff. But other than that, there was never a time that you could ever go in with anyone. And I think that was a really massive impact. And I don't think people realize how big of an impact that is, because you need your family and your friends there for emotional support, and you just don't get that.
I mean, I was lucky enough to go through it before COVID hit, and I can't imagine what it would have been like to go through that, by myself. I mean, hats off to you. I know that you didn't have a choice in it, but it's unimaginable. It really is.
And I mean, I am just so thankful that none of my treatment was ever delayed or stopped. I do know other people,
that's true,
had treatment delayed and stopped, which would have made things a lot worse. Thankfully, if anything, I maybe got through my treatment a bit quicker because they had delayed other people that weren't deemed essential. As in not cancer patients, as in other patients. So I potentially had things. So just quickly going back to my ovarian transposition, I might have not been able to have that if it wasn't for COVID, because I was told that I couldn't freeze my eggs. So when I was obviously told that I had the cancer and I would need chemo and radiation, I was told that this is going to put you into the menopause and that you wouldn't ever be able to have children. At that time, I was 29. I didn't have children, and I've always wanted children. So that was devastating. They just said I just simply didn't have the time frame of what people class as IVF or freezing eggs or whatever, it's a minimum of a month. If you think about the female body, you know, you need at least a month for your eggs to stimulate and stuff like that. I didn't have a month to wait. That was put very plain and simple, that if I waited for a month to do that process, then I might not be here to use my eggs in the future. It would be pointless. So the second best option that they could offer me was something called an ovarian transposition, which yet again, I might have not been given this if it wasn't for COVID, because a lot of the other operations had been cancelled. They were able to fit me in within 2 weeks to have it. And basically they moved my ovaries from their original position in the pelvis up to my rib cage.
Oh my God, I've never heard of this.
Yet again, nor had I. I was like, what do you mean? She was like, so we're pinning the ovaries up in your rib cage. So with the theory that it then gets protected. So basically my ovaries are no longer in the pelvis area, which means they're not getting zapped by radiation. So the hope was that I would be able to save my ovaries from being fried in the radiation. And then post-treatment, we would be able to freeze some eggs. That was always the plan, which I didn't even know this existed.
So do they then reposition them back down?
No, because they never unattach them, or if that's the right word, because apparently the fallopian tubes are so long and stretchy, they can reach from your pelvis up until basically your boobs. So they never, so I was continuing to still ovulate. I had period pains up here, and honestly, it was the funniest thing ever, walking around going, oh, I've got period pains. I think everyone probably thought you are a nut job. Yeah. But I still had periods throughout the first half of my treatment, and it did protect them from the radiation, which is amazing.
But how? So how would you then? You wouldn't be able to carry a child. You'll be able to.
No. So the hope, and it was always told to me that I could save my eggs and then freeze them, and then it would be for a surrogate to use in the future, because the radiotherapy would 100% zap your uterus and your womb, and you would never be able to carry. So but you know, I've got two sisters, I've got some amazing friends who all jumped at the chance and said we would carry for you in a heartbeat. So that was always the plan, which was amazing. And as you know, yet again, when you're kind of going through this sort of process, you do anything in your power. So we went through that, but unfortunately for me, the chemotherapy stopped my ovaries from working. So as much as we saved them from the radiotherapy, we weren't successful in saving them. So the same day I found out that I had the all clear from cancer, my consultant told me that, because I'd seen fertility specialists throughout, that they had said that my ovarian function was pretty much, well, it was 0.2. So it was, they were lifeless basically. And all my other bloods and stuff had suggested that I'd gone into the menopause by that point. Even though I had no symptoms, they said that my bloods, so they wanted me to start on HRT quite soon. So I got the all clear in the December 2020. And then in January 21, I was absolutely desperate to get a second opinion. So I actually had it was a Zoom call with a fertility clinic over in Greece, just because I was adamant, like they had it wrong and that it was someone else's bloods, because I had no symptoms of the menopause. I had more bloods taken, and they looked at all my files and they said, I'm really sorry, but it is correct. That is what it's suggesting. So I had to kind of come to terms with that. As much as I had all this hope, yes, I was never going to be able to carry, but knowing that biologically I was going to maybe have a chance of having some eggs and someone else close to me was going to carry, felt like that was kind of a second chance for me. But then obviously I got told that information, and there wasn't, I mean, I was adamant I was going to get a third, fourth, fifth, sixth opinion, but it was always going to be the same results. So in the end, you had to come to terms with that, which is heartbreaking. But the key thing was I was alive and I was here. If I delayed my treatment to save eggs and it had a poor outcome, then what good are my eggs in a freezer when I'm not here to do anything with them?
You're so right.
And then fast forward, so that was, you know, December 2020, got the amazing news. I was one of them annoying people every month. Oh my God, I'm another month in remission. Oh, 3 months. Yeah. 6 months. Oh my God, I'm doing amazing.
Yeah.
It was around probably that 6 months into remission that I first felt that I had really recovered, that, you know, all the side effects from the radiation, the tiredness and everything like that. I felt like I'd got my strength back. I could go back to the gym. It was around the May that I decided, you know, 6 months in remission, or June, sorry, 6 months in remission. I'm going to do another bodybuilding competition. I'm ready. Let's get that in the diary. So I had planned, and it was going to fall exactly on the day I finished my treatment a year later.
Wow.
So I was so pumped for it. I was like, this is like meant to be, and got back into training, was feeling so good. Just went back to work in June.
Yeah.
So I felt, you know, ready, get on with my life.
And were you having like regular scans or anything?
So our normal protocol is 3 months. So 3 months, 6 months, 9 months, and then a year. And then after the year, you go on to 6 monthly, unless you have symptoms. I didn't have any symptoms or anything like that. My main issue was my bowel issues, which they kept putting down to the fact that I'd had radiation damage.
Yeah.
But by this point, I was like, look, I'm going back to work. I'm going back to the gym. I can't keep running to the toilet. It's ruining my life. Yeah. I pushed and pushed and pushed from a bowel point of view. And finally, the gastro team agreed to do an MRI and endoscopy. And they did a few other things. And it was actually, I'd had my 6 month all clear with my consultant just a couple of weeks before. Yeah. I went for an MRI of my bowels in the end of June. And I got a phone call from my consultant a week later saying, we've seen something that's really concerning. And I thought, oh my God, my bowels, like, what? Yeah. And they just said, no, it's your cervix. There's a tumor in your cervix again. And I was like, but there can't be. And they were like, no, well, we're not convinced it is, but we're pretty sure it is. So yet again, I had to go through that whole thing. Thankfully, I was able, so I had a biopsy within a week, and my mum was able to come with me. And it was so surreal because it was the first time my mum had ever been able to come into hospital with me. And I almost like, I remember saying to my mum, like, no, Mum, don't bother coming, or it'll be boring for you, because I'm so used to doing everything by myself that I thought there's no point. But yet again, had the biopsy. Then they said they wanted an MRI and a PET scan. And my consultant said, I'll ring you next week. I'm sure the results are going to be absolutely fine. So I'll just call you. And then the day before, I got a call from the secretary saying, no, she wants to see you face to face. And she said, bring your mum. So I was like, so I knew at that point. I said to my mum, that's it. And yet again, you know, with our community, we speak to a lot of other ladies who are in similar situations. So I wasn't naive going into that. I kind of knew what I was going into. I was either going to be offered serious surgery, or I was going to be told palliative chemo. And actually, when I went in, they were the two things that we spoke about. They were my two options. And yet again, when you're kind of told something like that, I think you instantly go into like this fight or flight, don't you? And you just think, how's this happening? Yeah. How's this happening? It's not even a year since I finished my treatment, and I'm back here in this hot seat, and you're asking me to make life-changing decisions. Yeah. For me, it was quality of life over quantity. And I was very adamant, yet again, with my background, nursing children. I see a lot of children that are suffering for a long, long time. They have a very poor quality of life in and out of hospital because mainly their parents wanted them to have the treatment. And I was so clear with my mum before I went in there that if my options were, or if the outcome or my prognosis was poor, I'd like to take my chances. And obviously my mum was adamant that's not going to happen. Yeah. But I was basically told that I could have surgery to remove the tumour, which would include a full hysterectomy, which I said, take it, because it's fried from the radiation. It's not doing anything. The issue was the size of my tumour and the position had invaded into the lower part of my bowel and my rectum, which would result in a stoma bag. Right. And
so would that have been the reason why you were having the bowel issues then?
They don't think so.
They don't think so. Oh my gosh.
Which is crazy.
So the site of that tumour was different to where the first one was?
So it was the same site of the tumour, but where it had pushed out and where the scar tissue and everything from the radiation was, it just meant that it was causing a lot more pressure on the other organs. So I had bladder involvement. It was, the tumor itself was pushing against my right hip. And funny enough, after I was having really bad hip pain, they kept saying it was menopause and I needed to change my HRT. And all these things started adding up then. So yeah, I was basically told I would have to have surgery. It would be very, very, very likely that I would need a stoma bag because of the bowel and rectum. It's very likely that I would need a second stoma bag for my urine because of the bladder and ureter involvement. And then the nail in the coffin was, and where it is on your right hip, we're going to have to remove quite a lot of the tissue and nerves and tendons from around there. So you'll probably be not mobile. You'll probably be wheelchair bound. And yet again, one of them really stupid things that you say now looking back at it, I was like, so I won't be able to leg press at the gym. And she literally looked at me and was like, I don't think you're going to be able to walk, mate. Like, let alone leg press. One of them moments.
Like saying like you're potentially going to be in a wheelchair for the rest of your life.
Yeah. Pretty much from where it was in my hip. So yet again, I went, you know, I said to her, so what's my second option then? If I don't want to go through this life-changing surgery, then, oh, and just to add on top of that, we'll remove your ovaries that have died anyway. That's fine. And we're going to have to probably remove quite a bit of your vagina wall as well, which will probably result in sex being next to impossible. I was just sat there thinking, I'm 29 years old. Yet again, quality of life. What sort of quality of life am I going to have with a stoma bag? And I'm not saying that everyone with a stoma bag doesn't have a quality of life. That's not what I'm saying. But everything put together, I'm single. You know, I'm 29. I want to go and live my life. I'm a huge, huge gym fanatic person that competes in bodybuilding competitions. My life would have literally been turned upside down by this. So I said, so what's my second option? And she said, palliative chemo. And I said, so what does that mean? How long? And she said, well, put it this way, you'll be lucky to see your 30th birthday, which was in 10 months time, even with chemo. And I was like, oh, and in it again, then we went into that. So the risks of the chemo, high risk. One of the drugs is an immunotherapy drug. And she said that comes with a high risk of bowel perforation. So you might end up with a stoma anyway. You would lose your hair. You would probably be in a wheelchair because you'd be so weak. And I thought, so I'm going to end up in the same situation, but my life would be shorter. So I was like, so what's the next option? She said, do nothing. And I said, and how long is that going to? And this was August. And she said, 3 months max. And I just thought, what sort of, choices do I really have here? And I just remember walking out of there and I just said to my mum, sorry, but I just said, this is just shit. I said, it's a lose-lose for me. Like, whichever way, it's not going to be a good outcome. And the chances, even after the surgery, the chances were 40% of chance of cure. So I could go through all that surgery and they still can't remove all the tumor, they can't get clear margins. So I would be in hospital for, 3 to 4 weeks, and I would be completely bedbound for sort of 12 weeks. It was so much to take in. And I just thought, oh my God. And I just remember thinking to myself, I've got a bodybuilding competition coming up in a month. And I'm not going to be able to do that now, am I? And she just said to me, she was like, well, the way things are going right now with COVID, I can't get you a hospital bed for 8 weeks. And I was like, okay, so you're only giving me 12 weeks to live, but you can't get me a hospital bed for 8 weeks. It was ridiculous. But anyway, fast forward, I decided I need to have this surgery. It's my only chance of cure. And actually, I've got a couple of really close friends who would have given anything to be in my position because they weren't given the option of surgery. So they had recurrence of cervical cancer, but unfortunately for them, it was either in lymph nodes or it spread to other organs.
Right. So you still hadn't gone to your lymph nodes, had it, at this point?
No, it hadn't, which is just incredible. And it hadn't spread anywhere else. And considering, they were so surprised because my ovaries were still connected. They were so surprised that none of the cancer had tracked up the ovaries to where they are, because and then invaded up there. They are just amazed that that never happened. So to be honest, it was more because I just saw someone say what made me make my choice. So I had two reasons. I had my family, because I wasn't prepared to leave my family behind and let them watch me suffer for however long I had. And second of all, like I said, I had my friends who would have given anything to be in my position. They would have taken the surgery in a heartbeat if they were offered it. And unfortunately, they weren't offered it and have since passed away because the treatment that they were offered was end of life care. So they were the two reasons why I did it. And selfishly, I thought, well, you know, I can't keep saying I don't want this treatment because it's my only option. Whether that means my life is going to be crap or not, I'm still going to be here to have a life. So I had the treatment. Well, I had the surgery in the morning, went in. Oh, I'll just add, I competed in a bodybuilding competition 3 days before my surgery because I was adamant I was going to do it.
Oh my God.
Believe me, when I set my mind to something, nothing is going to... I went for a PET scan the day before.
Oh my God.
So I went for the PET scan.
Can you hear yourself?
Yeah, honestly, I was the most glamorous tanned person in ITU after that surgery. They were all like, did you have a spray tan for this? I was like, no, I did a bodybuilding competition a few days ago. My mum was there scrubbing this tan off me. But I was so adamant. I was like, this is going to be my last chance to do this. I'm not letting anyone... I was high off my face on morphine because I was in so much pain, prancing around in a snazzy bikini and heels. You know, I just thought, look at
how
the
did you
state
do?
of me. Well, I had an amazing time. We had to go all the way to Manchester as well, which wasn't, but it was a big lineup. I wasn't expecting to win or anything. I just wanted to do it.
To do it and take part.
Yeah. And I'm so glad I did. So I went in for the surgery. That morning, the stoma nurses came round, put the marks on me. Yeah, well, we need to fit you up for 2 because obviously they've said that you might need a urine and a bowel one. And they were like, oh, we're going to have to get a kid's size bag because you're so tiny. Because I've just competed. They were like, you're so tiny, we can't fit the adult size bag on you. Like, we were at least having a bit of a joke about it. Yeah. But inside, I was absolutely petrified. And
I'm not surprised.
Went down for the surgery. Obviously, I don't remember any of this, but my mum and my best friend were they couldn't come in, but were in and around London in case they needed to come in. They got the phone call. I think my surgery was 9.5 hours. They had, and yet again, my mum and my best friend both said on the phone straight away, does she have a stoma bag? Because they knew that was the one thing that I really didn't want. And they said, no, she didn't need the stoma bag, which is incredible. They said that the tumour had been pushing against my bowels and my rectum, but hadn't actually attached. So when they took the tumour out, it hadn't got stuck.
Right,
okay. They didn't have to remove it. So a no bowel stoma bag. However, I had to have a temporary urine stoma, a suprapubic catheter, which came out of my tummy, because they had to remove, the tumour had gone into my right ureter, which is obviously the tube that brings your urine out.
Yeah.
So they had to cut away, I think they said about 10 centimeters or something of that. And they were able, so usually that would be permanent stoma for your urine because there's nothing you can do. You've had to take away that tube. However, my amazing urologist, don't even ask me how, he took part of my bladder, reconstructed it to be my ureter. But so I now have that permanently. So I've got a smaller bladder because they had to take part of that away to reconstruct, which is just incredible what they can do. So I just needed the temporary urine stoma.
So that's gone now. The urine stoma's gone.
Yeah. So I had, don't get me wrong, I had issues with it. I had several infections. I had a couple of operations. I had stents, but I only had it for 10 weeks, which is incredible. Then it went permanently. And there's no reason. I've got a kidney scan and everything in a couple of weeks just to make sure everything is fine. But touch wood, there's no, which is just yet again incredible. And then the third thing, which was the icing on the cake, the tumour yet again had invaded and what they called bulged into my right hip, but hadn't attached to anything. So they didn't have to actually do much removing of the right hip. I have some nerve damage. I have some nerve pain, which I take medication for, but I have full mobility.
But no wheelchair?
No wheelchair. I was in a wheelchair for 6 weeks post-surgery just to recover. But then since then, I've had no issues with that. And yet again, like everyone I see, like as in, you know, doctors and stuff are like, I just can't believe, I don't want to use the word lucky, but they're like, I just can't believe how lucky you were when we opened you up from your scans. It had such a poor outcome to actually then find that it was only attached to one thing, which was your ureter, which we were able to replace by taking part of your bladder, which is just incredible.
That's got to give a lot of people hope, you know, that.
And I'm not saying it is, I'm not saying it isn't, but I took part. I went for oxygen therapy, the high dose oxygen therapy, because I was told it could potentially help heal your bowels, and my bowel symptoms were so bad.
Yeah.
And I went to that, and I did that for 5 weeks, and 3 sessions a week, which is what they recommend. And I can't help but think that that has helped, because it's meant to help with the healing and scar tissue and scar damage and everything like that. And I just can't help, you know, my consultant was like, I've never seen a radiated pelvis come apart like that before.
Wow. And it's, like, that's not on the NHS though, is it? No, you have to sort that out privately.
But one of my amazing followers, because I put it on here because I didn't really know much about it. It's a American thing, but the MS Society, they have some clinics dotted around, and I'm so lucky. I've got one 30 minutes from my house.
Yeah.
Oh my God. They only charge £15 a session, which is nothing. If you go private, I think it's about £120, £130 a session. They only charge, they want a donation basically. And so you have to donate £15, which is amazing. Incredible. So I'm not saying it definitely was, but I can't help but think, if my consultant has said, I've never seen a radiated pelvis come apart like that. Usually her words were, well, the technical medical term is a frozen pelvis. But she said it's literally like everything is just stuck together with super glue. So they can't take out, like we would normally have a hysterectomy, and you don't even have to have anything else taken out. But because the radiation sticks everything together, it just means you can't take anything out without the whole piece coming out. So she just said she'd never seen that before. So I came away, I think, super, super lucky. And I really didn't have anything, you know, that was going to be long term for me. I did have, I think it was 8, I had multiple infections and stuff, and then 8 weeks after surgery I was rushed into A&E with bowel obstruction, which was caused by the scar, like adhesions and stuff that had built up from the previous surgery.
Were you worried that was another tumor?
Yeah, very, very worried. But thankfully, you know, they reopened. And yet again, I went into that surgery. It was, I was actually in Bournemouth visiting my family. And
that's where I'm from.
Oh, really? So I was in Poole Hospital, and I was begging them to take me back to UCL, only because I was like, look, they know me there. You guys don't know nothing about me. I'd only had the catheter taken out 3 days before.
Oh my God, I'd be the same. You just want to go to where you know.
And they literally said to me, you're in bowel obstruction. Your bowels are going to die. So we can't transfer you. And they basically said, like, we need to rush you into theatre, because obviously the longer we leave it, the more chance you're going to have of a stoma. And as soon as I heard that word again, I was like, oh, I've literally just gone through all of this. And I just remember crying to my mum, being like, Mum, I can't go through this again. Like, if it's cancer, what are they going to do? If it's not cancer, but I end up with a stoma, what am I going to do? And it was just such a it happened all like so quickly.
So
but
how long ago was that then?
The bowel obstruction was the 13th of November.
Oh gosh, it's really recent.
Yeah. So fairly, and I mean, I was only 8 weeks. My initial surgery was the 8th of September. So I'd only just started recovering. Like I said, I'd only just got the catheter out 3 days before. Wow. And to be honest, the pain and everything I thought was my bladder leaking, because I'd had so many issues before with my bladder leaking every time we tried to take the catheter out. So I thought, oh, that's happening again. So obviously when I went in, they said, oh, the CT scan says that your bladder's fine, but it's your bowels. And I thought, oh, okay. Like, and they just said it is one of them things that happens to, you know, a few people. It's not a common side effect of the surgery, but it can happen. And I was then in Poole Hospital for 10 days, Neil by mouth, on TPN, in a worse state than what I was when I was
for God's
going
sake.
through all of that. It was horrendous. And I just think that was my lowest point, because I just kind of got over that first treatment, to then be slap bang in the second of the second cancer treatment. And I felt so good coming out of that. And I was like, oh my God, like, this is the best outcome I could have wished for. And then I just felt so like deflated being in hospital again. And it was just really hard to overcome that. And to be honest, that was my biggest hurdle, to overcome that mentally and physically. So, I mean, I'm sick. Well, yeah, about 6 weeks post the bowel obstruction now. So I'm slowly getting.
It's still so fresh for you. So do they class you as in remission then?
Yeah. So in December, I had another PET scan and MRI, went and saw my consultant. She said that the scans are all clear, so there's no evidence of any disease anymore, which is just amazing.
Incredible.
It is. It really is. And like you say, when you've gone from, you know, what the journey I've been on, it was just hearing it for the second time, just it felt even better than the first time. And I know that sounds crazy, but it really did. And it was almost like I just felt so relieved, because I just thought, oh my God, like I know the outcome now, that if this ever does come back for a third time, there's no more treatment for me. So to kind of hear them words even like means even more to me now.
Yeah, I bet.
And the crazy thing is as well, she was like, you are just such a rare breed. And I was like, okay. So so the tumor was initially a squamous cell tumor,
right,
which is the more common.
Right.
The second tumor, when they obviously got it out of me and they sent it off to the labs and everything, it was a different type of tumor. So it was still cervical cancer, but it was an adenosine sarcoma tumor or something.
Does that mean it was more rare? The fact that
she said that she was like, I've never seen anyone like switch from having one type, or basically in theory having two types. And I was like, that's just weird, isn't it? Like how the human body does these things. It's just incredible.
And do you have family history at all of cervical?
Nothing.
No.
Absolutely nothing. I have no family history of cervical cancer. And I have no immediate family with any. I have like no immediate family with any sort of history of any cancer, to be honest. And yet again, I mean, they go on about it. I don't smoke. I never have smoked. I drunk at uni, but I drink 2 or 3 times a year now, and have done ever since I got into fitness. I eat extremely healthy. I work out every single day. I take care of myself. So I really don't fit into any of the criteria for somebody. And it is such a big thing at the moment, talking about this HPV thing. I never had it, and I still don't have it now. So I've had cancer twice, and neither of mine were caused by the HPV virus, and I have the vaccine. So
oh my God,
I just think, the vaccine yet again is another tool that they're trying to use. And I know I was one of the first years that was given it at my school, but all these things are coming around. It's such a concern. And I think as much as I'm trying to promote the smears, yes, they are really important. And obviously a lot of us were really upset when we heard the news about them being extended to 5 years instead of 3. Me and a lot of the other women were basically told, well, if you had waited another 2 years, you'd be dead. And it's true. But I think the more important thing, I think the smear testing, yes, it's great. I agree. But I think the more important thing is getting somebody to take you seriously and going and getting, someone to see you when you do have symptoms, and knowing the symptoms. Because like I said, initially, the abnormal bleeding, never thought cancer. The bleeding after sex, still didn't think cancer. It wasn't until I had both of them plus the discharge that then I put them 3 together and was like, oh my God, I've got cancer. But until that point, I hadn't actually thought about it. And I think that's more of what I try and tell people. Yes, smears are so important. I totally agree. But just knowing when to go for help and when to, and I always say to people, if your GP is refusing to give you a smear test, they're within their rights, because you have that 3 years for a reason. But they can't refuse for you to be referred to a gynecologist, and a gynecologist can do a lot more than a practice nurse can, who's going to do a smear test.
That is such good advice.
And I always say to people, if your GP says no, you're not due for a smear test for another year, that's fine. And I'll say that to people, that's fine. The smear test only tests for one thing, which is a big thing. But if you've got abnormal bleeding or discharge or pain, you could have one of many gynecological problems. And that's the thing, you need to then be seen by a gynecologist. And they have to refer you. They can't refuse to refer you. So that's what I try and get people to sort of know, that you need to know your own body, you need to know what changes are happening, and you need to know what to ask for.
Absolutely. And it's about knowing you're normal, and when something, you know, we all know our bodies so well, and when something unusual starts happening, I mean, I can't stress it enough, you know, you just can't leave these things, and thank God you didn't.
No. And that's the thing. And even down to the second diagnosis, okay, I was pushing for investigations for my bowels, but that was only off my own back, because they were just like, it's radiation damage, don't worry about it. If I hadn't have had that MRI, I wasn't having any abnormal bleeding or anything like that for the cervix. So how long would I have had that tumor for before I'd found out? So even though it's not directly related, I'm so glad I really pushed and got hold of the gastro team and was like, no, you know, yet again, you need to know, like, I feel like sometimes you need to have like these buzzwords, these keywords that then the doctors take you seriously. And I obviously, being in the field, I just kind of know what to say. So I kind of do get my way when it comes to things like that sometimes.
Yeah, good for you. And are you going to go back to work? Is that the plan?
Yeah. So as soon as I get the all clear from being physically fit enough to go back to work, because obviously I work on a ward with children, so it's a physically demanding job. But absolutely, I mean, I work at Great Ormond Street, so I've been there for 6.5 years. I couldn't imagine working anywhere else. I love my job. I love working with the kids. So yeah, I definitely want to go back. And now I have even more admiration for the kids.
You are going to be, I mean, I'm sure you're already an incredible nurse, but my God, you know, with what
just going through makes me realise how much we expect these kids. Like I said, as an adult, as a full-grown adult, I know the consequences and I know I have to do this. But with children, how do you explain to a child, oh, I have to give you this medicine that's going to make you really poorly, but I'm doing it because I want to make you better? Like, I just think the kids are even more incredible. The kids, what they go through, I just couldn't even imagine how they feel and how they deal with things. As a full-grown adult, I struggled. So I just think, it's made me admire the kids even more, and it's made me want to go back and be an even better nurse than what I was before, and do an even better job. Because yet again, if it wasn't for my team looking after me so well, I wouldn't be here now. So it just makes you know, unfortunate that I can kind of give back in that way. And it's the same with like the cervical cancer community. Like if I, you know, with all of us together, you know, we've got such a big voice to be heard, and if we can prevent other women having to go through anything like this, you know, early detection, prevention is key. So,
and you just have to keep doing what you're doing. And honestly, I've been, and I know people on here have been saying it right the way through, just absolutely blown away by, I mean, your story is incredible. It's insane.
I think sometimes I feel like I'm making it up, because I'm like, no way could that happen. You question it sometimes, like, no way, that wouldn't really happen, would it? And it does. And you just think, but and honestly, hand on heart, I do see myself as one of the lucky ones, because everything happens for a reason, and all these episodes of events that's happened have all happened. And look at where I am now. Like I said, if one of them things were missed, or one of them things were delayed, as much as it was hard going through this in a pandemic, but actually all these little things add up. And I just think, you know, there's a lot of women out there that would love, it sounds crazy, but they would love to be in my position. So as much as it has been hard, and I'm not taking it away, you know, it was the hardest thing. The operation was a million times harder than the chemo radiation, and that was hard.
Yeah.
So
I mean, God, the bit after the radiation, oh my God, that sounded awful. Listen, I won't take up any more of your time. Thank you so much.
No, thank you so much for having me on. Honestly, it was great to talk to you.
And I'd love to keep in touch and keep, you know, helping raise awareness for cervical cancer.
Definitely. Thank you so much.
It's so important that we do that. And thank you to everybody who's been sending such lovely
I know, I need to read them.
Messages and everything. Unfortunately, the messages that pop up on here get lost. So if there's any comments that anybody wants to say, I'll post this chat. And if anybody could
that would be amazing.
Repeat any of their comments, or if anyone's got any questions for Destiny, or please follow her, Bikini Girl versus Cancer. Do give her a follow. And
any questions, chemo, radiation, surgery, cervical cancer, smears, anything. I'm
bodybuilding.
Bodybuilding, if anyone cares.
Have a lovely evening.
Angie, thank you so much for having me on.
Take care. All the best.
Bye.
All right, bye.